Good morning, everyone, and welcome back to day 2 of Digital Health Days 2015. We are live online. Hello, world. Hi, Mom. We're off again to another great day. How many here were not here yesterday? Perfect. New faces. Welcome, welcome. And just in short, Digital Health Days is what we hope is an arena where we will try and set the agenda for tomorrow's digital healthcare, putting care back into healthcare. A place for inspiring seminars, workshop discussions, and dialogues. And as I said in the pre-talk, it's going to be great content on stage, but it's going to be fantastic coffee breaks. So looking forward to the day, definitely. My name is Donny Legonis, and I work as a business coach at KTH Innovation, the innovation office in the Royal Institute of Technology here in Stockholm. And my job there is to meet students and researchers that believe they have the next big thing. And some of them do. Some of them will actually be here today. We have an exhibition booth where some of our promising startups will be showing their ideas here during the day. So please take a chance and go over and visit them and have a chat later on during the day. And just as yesterday, I am not alone here on stage. I have the lovely and wonderful Sabine von Gafke with me on stage as a co-host. Sabine, as you know, has over 14 years of experience as a TV presenter and also hosts the TEDx talks here in Stockholm. So very experienced. I enjoyed having you on stage here with me yesterday.
I enjoyed being here.
I feel very safe with you here on stage. It's perfect. What was your sort of big takeaway from yesterday? Anything special you
Well, I think there was a lot of talk about, the patient-centric, that we have to focus a lot on the patient and listen to what the patient has as opposed to just the industry. But I think also there was a lot of talks about implementation. I mean, there's so many good ideas, there's so many visions, there's so many possibilities and technology. But we need to also walk the talk and see how do we implement that, both within the health sector industry, but also to make it available for the patients, the sort of whole infrastructure. I think that was my main impression.
Personally, I also enjoyed the new format we have. Everything, as you know, happens in this room here. We have a main stage and an audience here, and then we have breakout sessions in the same room. We have exhibitors in the same room, and down at the far back, we have our post-it wall, which is our notice board. Please use that, add posters, post-its and comments and questions, and if you would just classified ads. And on that side, the other side is our art wall, where we are together co-creating artwork of where we feel that digital health should move. So please add to that as well. And all the breaks will also be here as well. And then last but not least, we have the whole world connected with digital, social, and also a cage. Could you mention anything about that?
Yes, of course. I mean, I presume most of you heard the pre-talks, but we also talked about the digital reach, that of course, all of you here attendees, you're a dynamic mix of patients, professors, investors, people within the health sector, but it's also important for us to get a digital reach outside of this, and therefore social media is so essential. And that's why it's so pleasing to hear Bastian, who works with us, that, we had 560 tweets done by us, and they were reached, 36,000 people or more, and we're just hoping to get a bit more today. And the cage, as we call it, now has 3 commentators. You're going to introduce yourselves, and the whole point of this is also to have sort of a reality check, or the voice of the people, or the experts in this case, to get feedback and insights and commentaries after the keynote speakers. So please, just a quick presentations of you 3.
Well, I'm Bastian Franze. I'm a recent graduate on the Health Informatics program in Karolinska Institutet in Stockholm. And besides the fact that I'm a new designer of the healthcare system or technology in healthcare, I'm also a patient as well. I have type 1 diabetes for 27 years now. I'm 28 years old myself, and I've seen many improvements that have been introduced in the field of healthcare right now, but I see that there's a gap between what technology brings and what people actually want. So yeah, I'm trying to make this bridge between technology and what people want and need in healthcare.
You're an important voice.
Thank you.
I'm Elizabeth Nelson. I was here yesterday. I'm a PhD candidate in the Netherlands studying positive behavior change with digital health tools. And I'm the writer for the Humans for Digital Health blog. We had some fantastic articles on there. It's a great thing to review, and hopefully they'll be on Twitter today a little bit too. And really excited for everything that's coming today.
Hi everybody, my name is Jenny Kristensson. I work patient advocacy for AbbVie, both in Sweden and in Europe. And my job is to connect our world with the patient environment, making sure that whatever we do actually start with the real patient need. And I tie to what Bastian said, it's important to start in the right end and make sure that these people don't fall out of their work environment and can keep doing what they want to do, and whatever we do should support that. So I'm looking forward to today.
Thank you.
Excellent. So,
yeah, just in brief, for those of you who are joining us today, we have 3 themes that were also the 3 most voted themes by the attendees last year, and that is patient in focus, sustainability, and implementation, and that's sort of where all the talks will revolve around.
yeah, speaking of talks, shall we get them going?
I think we should.
I think we should. So, it's my great pleasure to kick this off with an entrepreneur, an advocate for digital health in general. She stressed the fact that her surname, Zilonka, is pronounced like tsunami, which is what I think she is as well within the world of digital healthcare. Welcome up on stage, Juliana.
Good morning. Thank you. Good morning, Donnie.
One very quick question before I let you get on with your talk. I know that you're here to talk about Lara Companion, right? Which is a service that helps childless couples get pregnant. Yeah.
Exactly.
But you know, the idea. What was the sort of when did you get the idea? Was it like a serviette on a cafe and, we need to do this, or what? How did you get the idea?
The idea is actually based on 3 years of research, asking the patients what is really the problem behind their disease.
Yeah.
And the problem still isn't solved, and because I'm an entrepreneur, I like to fix problems, I'm trying to fix it.
Okay, well, I will leave you to it. Good
Thank
luck.
you very much.